Hello, I'm Dr. Collins, and in this concept video, I'm going to show you a super memorable way of remembering bladder pharmacology. Meet bladder pig. Oh, hang on, that is Peppa Pig. Here is bladder pig. This little guy is going to make remembering bladder receptors a piece of cake. So let's draw him together. The three key receptors located in the bladder are beta 3 receptors located in the detrusor muscle, here represented with the eyes of our little piggy, alpha 1 receptors located at the bladder neck, represented with the mouth and the sticking out tongue of our little piggy. And last but not least, muscarinic receptors in the detrusor muscle as well as the urothelium, which are represented by the ears of our little piggy. And there it is, our bladder pig, proudly reminding us of the key receptors that are clinically relevant and important to remember. Now let's explore why it is clinically relevant to remember these receptors. Starting with the eyes, represented by the beta receptors, think mirabegron, which is a drug that works by stimulating beta 3 receptors in the detrusor muscle, causing the bladder to relax during the storage phase, reducing urgency, frequency, and leakage. A very popular medicine used in urge incontinence. But here is an excellent example of why it is important to know the mechanism of action of drugs. When you know that the mirabegron works on the beta receptors as agonists, you will remember that they also present in other key organs such as the heart, which means that one of the key things to check when you're doing medication review for a patient is to check their blood pressure also, because mirabegron can increase blood pressure, and therefore this may be a drug that we might have to withhold or discontinue if the patient has uncontrolled blood pressure. Now let's explore the mouth of the piggy, represented by the alpha receptors. Think doxazocin, which is an alpha-1 blocker which relaxes smooth muscle at the bladder neck, improving urinary flow. This is a commonly used medication in benign prostatic hyperplasia. Here again, an excellent opportunity to demonstrate why it is super helpful to understand the mechanism of action of medications in helping anticipate side effects and help us understand what we should be checking during medication reviews. Alpha receptors are located all throughout the blood vessels in the body, and they play a key role in vasodilation, and hence why doxazocin may also cause blood pressure drop, which is why it is also used as an antihypertensive. But in the context of bladder pharmacology, you need to review the blood pressure of a patient who is on this medication, ensure that it is not causing undesirable postural hypotension and dizziness, especially in older and frail patients. Now let's move on to the ears of our little piggy, represented by the letter M, the muscarinic receptors. Think oxybutynin, which is an antimuscarinic drug, also known as anticholinergic, that reduces the involuntary bladder contractions. Another very popular drug in helping manage urge incontinence. But again, this is where understanding the mechanism of action really matters. Muscarinic receptors are not just in the bladder, they are widespread all throughout the body. So when you block them, you get the classic anticholinergic side effects: dry mouth, constipation, and blurred vision. But also remember that acetylcholine is a key critical neurotransmitter in the brain as well, responsible for learning, memory, and cognitive function. So antimuscarinics, or in other words, anticholinergics, can create considerable risk factor for developing dementia. So this should be carefully assessed and discussed in medication reviews with the patient as well. Alright, quick recap. Bladder has three main receptors, represented by the eyes of our little bladder piggy, the beta receptors, the mouth of our little piggy, the alpha receptors, and the ears of our little piggy, the muscarinic receptors. Thanks for watching. If you like this video, please like and subscribe to fuel the passion to create more videos. And don't forget to check out our other clinical concept videos in our channel. Good luck!